And on the same lines, really, what's your message to people planning to celebrate Christmas on the island? Is it still one of caution?
Well, I'll take a first part of that. It's if everyone behaves responsibly and follows the rules, it's business as usual on the Isle of Man. I want everyone to enjoy Christmas. Yes, be sensible, but and try not to cause an incident where you may have to go up to hospital. So drink reasonably within your capacity, and don't cause an event where, as I say, you may have to be a nuisance to our hospital or our emergency services or our police ambulance, etc. Regarding the United Kingdom and other jurisdictions, I try not to compare ourselves with them. They have their own rules, their own situations where we're totally different. I think the only thing I would say is that the virus isn't going to kick a football around on Christmas Day and call a truce, and therefore it's going to carry on infecting people every day of the year. It's not going to take a break for 5 days. So, but that's the United Kingdom's decision. They are in a totally different position from ourselves, and I leave it to greater minds than mine to look after their situation. I don't know, David, if you want to comment on some of the other points.
Yeah. I mean, in terms of the United Kingdom, obviously different jurisdictions have to make the decisions that are best for them. All countries around the world are in a difficult situation. They're all experiencing different outbreaks in relation to the virus. Some, such as ourselves, are basically COVID-free in the community. The UK is in a different situation, so they have to make the decisions they believe is right for them.
Thank you. My second question, the figures involved in supporting air routes during the pandemic so far has been revealed as around 3.3 million. What's the figure so far for the government-owned steam packet company?
Well, that figure is something that the Treasury Minister will be releasing in his budget. I haven't got the exact figure at this moment in time. Obviously, there is financials to be taken looking into the building of the new boat, etc. But it will be in the millions of pounds. But we have to be pleased that we owned the steam packet at the time. We were able to ensure that it sailed regardless of whether it had anyone on board, to ensure that we were able in the early days to get the oxygen that we needed for the hospitals brought over, and that we were able to bring over key workers and supplies that the island desperately needed. So I think it's money well spent. It's going to be in the millions of pounds, but again, it's something we had factored in to our recovery position. I'm sure the Treasury Minister will be giving details in the future, but I have to say that the Isle of Man is in a far better financial position than we had the case prepared back in April when we were looking at where the island would be. So yes, we will have to put money into the steam packets because they've had to run empty to ensure we had that connectivity with the UK. But I think when you look at the bigger picture and the cost that other jurisdictions have experienced on a pro rata basis, the Isle of Man has done exceptionally well.
Thank you very much.
Thank you very much, Simon. Now we move on to Tim Glover from Manx Radio. Good afternoon, Tim. Faster my.
Faster my, good afternoon. Just one for the Health Minister here, because I know there's an urgent question in Tynwald about delays as Mr Bill Shimmon's MHK sees it. You mentioned documentation, waiting for that from the UK. What's different to the Isle of Man compared to Guernsey and Jersey, who've obviously got this documentation in place?
Well, my understanding is they don't have that documentation in place. I did a call with the UK yesterday. All three Crown dependencies are waiting on the documentation. Guernsey is in a similar position to us. They will not start the vaccination programme until the appropriate documentation is in place. Jersey's in a slightly different situation because they, of course, have at the moment quite a large amount of community transmission ongoing, and they've got about 5% of their population, I believe, currently self-isolating. So they have taken the approach of going ahead without the documentation in place. Ourselves and Guernsey have taken the decision that we will wait for the documentation for all the I's to be dotted and the T's to cross, the T's crossed before we actually go ahead.
Yeah, can I just say, Tim, this isn't a race. We want to do this thoroughly and give the best possible service to the people of the Isle of Man. We haven't got the COVID-19 circulating in the community. We want to get this right and make sure it's as smooth a position and system as possible for the people of the island. But equally, we respect that other jurisdictions will do it slightly differently from us. And as the Health Minister has just mentioned, sadly, Jersey aren't in a good place at the moment, and we wish them all very well. All the best.
Just to follow up, you mentioned that you still have documentation. What is the documentation?
The documentation is around the indemnity in relation to the vaccine. We have had confirmation that the Crown dependencies, which I think we've discussed before, was part of the wider indemnity. We're just waiting for the final wording of that before we will then proceed.
Thank you. And my second question concerns capacity at the hospital, because I know you brought in the winter plan, and figures in a written answer show bed occupancy before and since then. Could you just give more detail, which is contained in there, so it's out in the public, as to what the reasons are for this? And has the hospital got the capacity to deal with a major influx or a major incident currently?
Yes, we have. We have our COVID, particularly if it depends what you mean by major incident. There's two different plans there. If it's a COVID incident, we have obviously our COVID plans in place. That has not changed. We have the capacity to deal with that and to be able to keep people in isolation. We also have, as we always have at all times of years, of other contingency plans. Say, for instance, heaven forbid, there's a major vehicle incident where we need to bring people in through A&E. Those plans remain in place as normal. In relation to the reasons why the bed capacity is actually filling up, I think I've said before that it's actually a multitude of reasons. There's no one emergent reason that we're seeing a large amount of cases in one particular area. It's across the acute space that we're actually seeing an increase, and that's exactly what the winter plan is designed for, to be able to try and cope with that and ensure that we have capacity in the hospital, that we don't end up with the situation as we see in Northern Ireland, where we can still admit people into the hospital as required.
Can I just follow up there? Because in the written answer you say it's availability of nursing staff and the side rooms on wards that figure quite prominently. And I think on the first second you had 5 beds reopen in Ward 12.
Yeah, well, in terms of that, yes, there is staffing issues as well, because one of the things with the side rooms is people who are, being for medical treatment in the UK, and then they're being discharged from the UK, coming back, but requiring medical treatment here. They have to be isolated away for the 14 days, or as long as they stay in hospital, if it's less than the 14 days, and they require, therefore, one-to-one nursing care in those rooms. So that does put pressure on the staffing, and we have obviously seen more of that this year than we would in normal years.
Thank you.
But in terms of conditions, like I say, it's spread across the entire acute area. It's not one certain condition that is causing the bed pressure.
Yeah, I think it's important to point out, Tim, that because of the actions that we've taken in not easing off some of the restrictions when it might have been borderline that we did, we're not in the position where, sadly, the good people of Wales and Northern Ireland are finding that they're having to wait in ambulances for a number of hours, and I hope we never get into that position. And that's why the Council of Ministers sometimes seems a little bit cautious, but we're always looking at the bigger picture, and the winter months is a really tough time for our hospitals anyway, and I would call upon everyone to do their best to ensure they put as little pressure on those facilities as possible.
Thank you.
Thank you very much, Tim. We now move on to Helen McKenna from Isle of Man newspapers. Good afternoon, Helen. Faster Mai.
Good afternoon. Firstly, are there any extra medical staff to be trained to administer the vaccine, and if so, how many?
David, I'll let you take that one.
Yes, yep. So we've put out the appeal, Helen, for retired staff if they wish to come back on and they were appropriately qualified, and we've had a phenomenal response to that. But if there is anyone still out there, it's a good opportunity for make the appeal again. If they're appropriately qualified former medical staff and they want to help with the vaccination programme, they can get in touch via email at lead@gov.im to be able to register their interest. We will have people, I think, throughout the vaccination programme coming forward, when it's a rolling training programme. In terms of our own staff that will be delivering that training, I believe is pretty much complete. We have bank staff who've been appropriately trained up as well. I think off the top of my head it's about 80 individuals that we're currently training up to be able to deliver.
Thank you. Secondly, what security measures will be in place to protect people receiving jabs and giving them, obviously, you mentioned in the care homes. So will there be police or security staff at the designated areas?
Well, we hope we won't need police and security staff at the designated areas in order to administer the jab. Obviously, there is various protocols, which I can't discuss here, around the security of the vaccine and the transport of the vaccine that we have to comply with, both from the UK government point of view, who's supplying it to us, and also the manufacturer, Pfizer. There is protocols around that, but certainly at the vaccination centre, you know, it's not a prison we're running. We are running a vaccination centre. People will turn up, and they've got to have the allotted time to do it as well. So people can't just turn up to get the vaccination, as we've explained before. People have to wait until they are contacted, and then they book via 111.
Yeah, this is the Isle of Man, Helen. We don't need that sort of thing over here, but we will obviously have people to help people, get marshalling them to so they know where to go. So there'll be that sort of support, but only help. I'd be very, very disappointed if we ever needed to have police or security at these places. It's just not the Isle of Man way. And your next question, Helen.
Just finally, you mentioned about there being people being trained. So the government's COVID vaccination programme board, does that include people that are actually carrying out the vaccinations, or obviously in the press release you've listed public health officials and community and pharmacy professionals?
Yeah, the Vaccination Board is a strategic board. So it's the board overseeing the entire project. So that includes a mix of people. For instance, there is the chief executive of the department who's on it, public health are on it, but it's a strategic board. It's not dealing with the delivery on the ground. That will be down to the clinicians who are there and the line management within the vaccination centres. It's setting the overall strategy as to how the delivery rolls out.
Thanks very much, Helen. Now we move on to Alex Bell from BBC Isle of Man. Good afternoon, Alex. Faster my.
How likely, Chief Minister, would you rate the vaccine rollout as beginning next Monday, or is it more likely to be January?
Well, I think it's pretty high. Obviously, our style has always been to be cautious and not promise something that we can't deliver. So I would be disappointed if we can't do it on Monday, but if there was a reason, we've said the 4th of January would be the latest. So cautiously optimistic that Monday we'll hit the ground running. But I keep on stressing we haven't got COVID over here, and therefore it's about getting it right. It's not a race. We want to make sure that we've got all the people lined up ready to do it properly, and therefore the experience that the people of the Isle of Man get when they're having the vaccine is as smooth as possible.
Yes, granted, it's not a race, as you say. Well, the UK is racing for a vaccine, Jersey racing for a vaccine. We do follow the UK's clinical standards, so some point in the future when these places are maybe back to normal and we're still cut off, will slow and steady still be good enough?
Well, I would expect us to catch up pretty quick. I mean, the first few days, the first tray, I'm sure there'll be lots of learning curves. There's no manual on this, but you have to remember that the UK sadly has a significant infection rate. So sadly, I think Jersey's 2-3 times the United Kingdom infection rate, and therefore Guernsey and ourselves are making sure it's steady. It's not going to be lackadaisical, of course, but we want to do it properly at the start. I don't know, David, if you want to expand on that?
Yeah, one of the things I must say is, although it's a logistical challenge for us, Alex, it's a lot more of a logistical challenge for the UK. So if we take the first phase, care homes, in terms of the vaccination, it's got to be defrosted as an entire tray. It's then got to be stored potentially in a fridge. You can only keep it for up to 5 days. The vials come with multiple doses in, which have to be separated out and mixed. And once mixed, have to be delivered within 6 hours. Now, for a small island, although it's a logistical challenge, it's nowhere near the logistical challenge of the UK, who may have care homes miles and miles and miles away from where they're storing the vaccine. And the other crucial thing is the vaccine cannot be shaken either, so there can't be any disturbance to the vaccine. So in terms of us, I think we will, not just on population size, but also our logistics, catch up with the UK quite quickly.
Okay, well, Guernsey do appear to be ahead of us because we understand that they have started vaccinating people now. I think there's a real concern that the Isle of Man is at the back of the queue here. Now, you say cautiously optimistic about next week, if not, then New Year. That's coming across to some people as complacent.
Not at all, Alex. We're not complacent at all. We've got 2 trays of vaccine, and that's a very good news story. We've got the 2 trays of vaccine in our possession. That means we can vaccinate 975 people. But what we have to do is ensure that we do this right. So we have to ensure that the correct paperwork around indemnity, the correct delivery mechanisms are all in place, and people have to recognise that takes time. Now, I'm not aware that Guernsey has started vaccinating yet. I know they are in possession of their trays, but my understanding was they were waiting for the paperwork from the UK as well. I'm happy to be corrected on that if they've suddenly started, but that certainly was the position a few days ago.
Thank you.
Okay, thank you very much, Alex. Next we move on to Josh Stokes from ITV Granada. Good afternoon, Josh. Fast am I.
Good afternoon, Chief Minister. Can you tell us a bit more about the arrival of the first vaccine batch? We've been told in the press release that it arrived in the early hours of Wednesday morning. Can you tell us, when did you know the vaccine was coming over to the island, and did it arrive by plane as expected?
Right, well, that was more, the technical delivery was more David's side. Obviously, I was told once that it arrived, I was told it was on its way, but the actual time and details David's department will have dealt with.
Yep, in terms of it, we knew several days before. But again, with our cautious approach, until we actually had the vaccines in our hands and we knew they were there, we weren't going to go out publicly and say that we were getting the delivery, because as we've discussed, we don't want to get people's hopes up falsely. We like to be cautious. So we did know a couple of days before when we were likely to receive them. In the end, they actually came by boat.
Oh, that's interesting. Is there any reason why it arrived by ferry and not by flight? As you've said how fragile the virus is, surely there must be a concern now that it's travelled by boat.
No, they are dry ice packed for transport. The bigger concern is at the point where you've defrosted the tray. When they're coming over as frozen, they are actually at the -70. They're dry ice packed, so it's a very large amount of packaging around the virals. But it was the logistical way of the UK getting it to us.
So will the future batches be arriving by sea as well?
Well, we will wait and see. The contractual arrangements for the transport into the island rest with NHS Supply. So the companies that they contract with for the security and transport, ultimately that will be a decision for them.
But presumably you'd prefer it to come on a plane?
To be honest, it does not make a difference, because, as I say, with the frozen trays, the way they're dry ice packed, in terms of transport, whether it be plane or sea, it's exactly the same. You can have turbulence on a plane, so it just need, as long as the protocols are followed, there's not an issue whichever route of transport they come.
I think it's fair to say, Josh, we're learning all the time with the virus and with the vaccines. This is something new, and now that we know of how they can travel in the dry ice packs, it makes it a lot easier for us to understand the best ways to how to handle it, Josh.
Okay, thank you. And my second question, just this week we've seen the length some people are willing to go to enter the Isle of Man to see loved ones. Are you able to confirm if there will be any immediate changes to those in the UK who have doses of the vaccine? Is there any leeway in allowing those who have had the vaccine to come into the island, even with a period of self-isolation?
Well, at this moment in time, Josh, when we're not certain whether or not they will still carry the illness, COVID-19. The vaccine is there to stop them getting seriously ill from COVID-19, but we don't know if it stops them from being a spreader of COVID-19. So at this moment in time, the answer is no. Obviously, we're looking at new procedures for the new year, but that will be, again, based around infection rates in the United Kingdom. But all the time, we're learning new information about this virus and how the drug works and hopefully how long it will be active for. I don't know, David, if there's anything additional things you'd like to add to that.
I think you've summed it up very nicely, Chief Minister. It will depend upon where the science goes around the vaccine. As the Chief Minister said, we don't know with the vaccine yet whether it prevents you actually contracting COVID-19, carrying it and passing it on. And obviously it would be completely reckless for us to make those decisions without that form of information and that scientific evidence there.
Okay, thank you.
Thanks very much, Josh. And last but not least, we have Sam Turton from Jeff the Mongoose. Good afternoon, Sam. Fast am I.
Fast am I, Chief Minister. I just wanted to say, with the Oxford team looking increasingly confident that they'll be able to get their vaccine licensed in the new year, is the plan going to be to use the one vaccination hub, as it were, or do you intend to, with that, then change tack in the new year towards more targeted, shall we say, approaches where you can go into the community and vaccinate that way?
Yeah, I think when the Oxford vaccine comes out, Sam, it'll be a lot easier to send the vaccines to GP surgeries, etc. It's not quite the complexity of the Pfizer vaccine, but I'm sure David will be able to expand on that further.
Yeah, there's been conversations going on around primary care. We have been engaging with the GPs who seem very keen to be involved and to help us deliver the vaccination programme. So my thanks go to the GPs in that regard. We should therefore, with the Oxford one, be able to potentially roll it out into primary care centres, which would make it a lot easier to deliver rather than having to just use the central hub. But we await the Oxford vaccine becoming available before we start going down that route.
Thank you. And then secondly, with the quite infamous entrance into the island this week, it sort of raised the issue again of people who've said that there have been ways that people have managed to abuse the system for entry permits. How well is this being regulated, and have these concerns reached yourselves that people are able to, for example, one thing people are saying that they're setting up companies, they register on the island and then move to Ireland that way. How concerned are you about that, and what is being done to counteract that?
Right, well, in the instance of this young gentleman, I did have it investigated because he'd been on the island earlier, but I had it clearly checked that he had every right to be there. He was working for a construction company that he'd been on the island before, or the project had started before the outbreak of COVID-19, and therefore a building was halfway through when the outbreak happened, and therefore it was quite legitimate that he came over to work to get a project finished over the line, shall we say. Now, of course, we have to go on an element of trust. Yes, we do checking, and the Great Manx public are very quick if they think something's been abused or someone's trying to pull the wool over our eyes to have it checked out. So there is an element of trust. But if you break the rules, if you lie, if you mislead our team and we find out, then there are pretty serious repercussions of that. So we cannot 100% say that everyone that's come to the island has told us the truth to get here. But if we find out any differently to what they've disclosed, then there is serious consequences for them. I don't know, David, if you want to expand on that.
Yeah, the one I was just going to come on to was you mentioned about companies, Sam. My understanding is you've got to show that it's a trading company. So you can't just create a company that's one person and then say, as a result, I'm going to move over but not do anything with that company. My understanding is as part of the application process, you have to evidence what the company would be doing. And in other forms of work, you have to actually provide proof of employment in order to be able to move to the island.
Thank you.
Thank you very much, Sam, and thank you all for those questions. Now, my intention is that this will be the final scheduled COVID briefing this year, but we await, of course, the outcome of the trade negotiations between the United Kingdom and the European Union, so we will see what the next fortnight has in store for us. Looking back, 2020 has been bleak and sorrowful in so many ways, and yet this year has brought out the very best in us. Despite the scale of the challenges we have faced, our community has rallied together, refusing to be cowed by the pandemic and the impact it has had on our lives. And I could not be prouder of all that we have achieved together, and it has been an honour to serve you as your Chief Minister. I believe 2021 will be a brighter year, and hope we will continue to sustain the remarkable and infectious community spirit that makes the Isle of Man such a special place. My plea to you is to continue to do what you have been doing all year as we enter the festive season. Look out for each other. Christmas and New Year can be a lonely time for some people. This year we know that there are those who may not be with loved ones as they had hoped for. Please do keep an eye on your family, your friends and neighbours. Check in on them. Are they okay? It really can make a world of difference. Now, one very important matter before I go, and I know there has been some concern about our border restrictions and what this means for Father Christmas. I am pleased to announce that a special exemption certificate has been issued for Father Christmas and his 8 reindeer. and this has been faxed over, and rest assured he will make it through. Now, on behalf of the Council of Ministers, may David and I, along with Henrietta, wish you all a peaceful Christmas and a very happy New Year. That's all for today. Thank you very much.